a little bit more. Okay, this polycystic kidney disease, it's a type of autosomal
Dominant condition.
Yes, excellent. Dominant polycystic kidney disease. So what we got, there are two types of autosomal dominant genes are responsible for development of this condition, right? There will be mutations of two types of gene. What are those? One is known as PKD1 and another one is known as
PKD2.
PKD2. Okay. In case of PKD1, in case of PKD gene mutation, the disease is more severe. Okay. And you can have a earlier onset of the disease. But in case of PKD2 gene mutation, it is less severe and the onset is late onset. All right. Now, we have to know a little bit deeper, okay? A little bit deeper. I'm sorry, but this is fun actually. In case of the polycystic kidney disease, this gene can encode a specific protein, okay? This is known as polycystin 1. And PKD2 can develop another protein. This is known as polycystin 2. Okay, now think very carefully. We got a nephron, okay, and of just like every cell, there is a cilia. Okay, there is a cilia. This is cilia. Okay, now if I zoom this cilia, just like this, suppose this is the cilia, okay, and over the cilia there are some receptors. This is our polycystin 1 and this is our polycystin 2 receptor. Okay, clear, not clear till now?
Yes, sir.
Okay, all right. Now, what are the function of this cilia? These are known as the primary cilia. Okay, now when there is a flow of urine, it causes like the movement of this cilium, right? When there is urinary movement, like the flow of the urine or urinary filtration are there, so it causes some movement of the cilium, just like the normal cilium. Okay, what it does is it can influx some calcium. Okay, it can influx some calcium via these receptors of polycystin 1 and polycystin 2. So these calciums are responsible for inhibition of abnormal cell proliferation. Now think, in case of a genetic mutation of PKD1, there will be polycystin 1, so there will be no cells that are responsible for, there is nothing, it is responsible for inhibition of the cellular proliferation. What does it mean? If you cannot inhibit that, so it will proliferate in a circular manner. What does it mean? That means there will be formation of cyst. One cell will proliferate another one, and you will have another one beside that, and by that you will have a formation of a complete cyst. Is it clear? Is it clear, not clear?
Sir, can you please go again?
Okay. So how far did you understand?
Sir, till the calcium influx.
Okay. So when there is a normal calcium influx, it causes the inhibition of abnormal cell proliferation. Clear?
Okay, sir.
Now, think if there is, as I said, there is a mutation. These are normal genes, right? These are normal genes and normal function of the cells are happening. But when there is a mutation in the PKD1, that means there is no production of polycystin 1 or PKD2 mutation, and there is no production of polycystin 2, right? It can cause what? It cannot permit the influx of the calcium. And if there is no calcium influx, so this inhibition will be off. What does it mean? There is abnormal cell proliferation, and it will goes like a circular manner. Okay, it will goes like a circular manner, and it will form into a cyst. Clear?
Sir.
Okay. Now,
Yes, yes.
So
just
this is the
there.
outpocketing, sir.
yes, this is the
That-
outpocketing. Yes, this is the outpocketing of the tubular epithelium. That's how it happens in microscopically. Okay. Is it clear now?
Yes, sir.
Okay. Now, what will happen is when there is a formation of cyst, it will have another channel. Okay, outside of its outside of the these cysts, it has some channels, and these channels can permeate the water. So there will be influx of water from our GFR filtrates. Okay, so inside we will have these glomerular filtrating cyst, okay, which is filled with the water, normally the fluids which are derived from the glomerular filtrates. Okay, and it can goes in a circular manner, and it can cause a generalized cyst formation over the kidney and cause the polycystic kidney disease. Is it clear for everyone how it will happen?
Sir, basically the water is filtrated in the glomerular basement membrane that
Yes.
will be taken up by the cyst.
Yes. Yes.
Okay.
Okay, and also you can have some kind of fluids. It can have some sodium chloride, water. Okay, it's a mix of all of the things. Okay, the filtrates that will be filtered